Leading things off on October the 11th, Bronx Community Health Network will hold their fall dinner. Everybody's going to be there, big names too. They're going to step into the room. Everybody's going to say, kaboom, look who stepped in the room. Well, joining us with all the details, as well as their programs, we have board president, Zahra. I put this together like this, Elmekkawy.
Very good.
Yes, indeed. And community health programs developer, Renee Whickey. Now, that wasn't a difficult one at all. Well, we welcome you guys to the show.
Happy to be here.
Tell us a little bit about what you're doing.
So BCHN, as I think you know, Bob, runs about over 20 health networks throughout the Bronx.
Yes.
We at BCHN strongly believe that access to quality health care is a human right.
Yes.
It shouldn't be dependent on where you live, where you work, your age, how much money you have on your bank account. So we're very committed to working with our provider partners and providing the full continuum of health care, from maternal and child health to teen behavioral health to nutrition counseling to substance abuse support, so the full continuum.
Yeah.
And we also know that the health status of individuals is very strongly linked to their socioeconomic situation. So our care model also relies on a huge network of patient navigators, community health workers, social workers that live and work in the community. They understand and appreciate the diversity of the Bronx in terms of its racial and ethnic and language background. And they're very committed to working with their neighbors. So these individuals link the patients with any other services that they might need. Referral to food stamps, food banks, help in making appointments across the range of services.
And Renee Whickey helps to create this great harmony amongst you guys.
Yes.
That's correct. Our team is very diverse. As Zahra said, they come from the community. They have a deep passion for helping their neighbors and helping people to navigate often a very complex healthcare and social support system. And so essentially they are bridges between the clinical world, the community, and the social support services that are available to them, like SNAP, housing, jobs, education, et cetera.
Yeah. Now, a lot of people don't know about a lot of what you guys are doing. And I'm glad you're here to explain a lot of it, because you mentioned a lot of different programs and a lot of elements to what you're doing.
Yep. I mean, as Renee mentioned, they can help with making appointments and providing referrals and escorting patients to their doctor's appointments and others, but also they do referrals to food banks, et cetera. And I believe last year, Food Bank of New York acknowledged BCHN as having made the most referrals in all of the Bronx. So again, we want to make sure that healthcare is a very holistic provision of services.
Yeah, so a lot of people coming to you, how do they reach you?
Sure, so we can be reached.
Do you have an outreach? Do you go into the schools and to the neighborhoods and
so
the communities?
Our outreach team is in the community. They go to health fairs, they go to schools, they do workshops. They're at faith-based organizations, community-based organizations.
Oh, you're out there, okay.
Yes,
That's some major
they exist
outreach.
at the health centers. And so we're actively seeking to identify people who need assistance. We can also be reached via the internet, email, phone, all of those avenues.
Yeah. Do they have to have insurance or?
No. So we serve any member of the community that comes to us. Some are insured, many are insured. Many are also relying on Medicare or Medicaid, and many are uninsured. So we're open to anybody that needs our services.
There's a lot of people, and you can probably help them out. Getting some sort of health insurance along the way also.
That's correct. Health insurance is a crucial access point to care. And so most of our team are certified application counselors, and what that means is they can help community members identify the plan that suits their needs, as well as help them sign up and get them into a health center.
So you get into Affinity Health Plan, Health First, you turn them on to a lot of those Metro Plus. And
that's right.
Yeah. That's good.
And this team works with the provider partners at Montefiore and Acacia, the fine physicians and nurses and doctors that we have working with us.
We're all family.
We're all family.
Yes.
And it's throughout the full continuum of life cycle of health services. So we have a program called Healthy Start, which works with expectant mothers and their families to make sure that they start their pregnancy on the right footing. We have programs that support those that are dealing with substance abuse. So we rolled out a program to provide naloxone throughout the community, which helps reverse opioid overdose. We have
you teach those classes also?
And we teach those classes, so
That's
Renee's
right.
team teaches those classes.
That's correct. They're in the community. They train people on how to recognize signs and symptoms of an overdose. They do a training, provide a kit. That way community members can save a life on their own.
What about people who are afraid to step up and get involved in the system for one reason or another and maybe need a green card?
And so there are a plethora of services for people who are undocumented, as well as services for people who are documented. And I think the struggle is that a lot of the community does not know how to access these services or what they qualify for. And that's why our outreach team is so crucial, because not only do they walk the walk, but they talk the talk.
Yeah.
They speak the language of the community, they understand the struggles, they understand the challenges, and they understand how to navigate those challenges and have those tough conversations
Yeah.
with community members.
Because a lot of people need health care, but they don't want to step into it because they think that somebody's going to snatch them off the street or
That's
snatch
right.
a family member off the street.
But if you have someone who is helping you to understand the process and what you can and cannot do and what you're eligible for and not eligible for, it feels like you have a team member in that struggle. And so that's an important part, building trust.
So we're going to get together and we're going to break some bread.
Yes.
Tell us about it.
So our fundraiser, we're hosting our annual gala on October 11th. And since so much of what we do relies on our partnership with community, other community agencies, individuals in the community, we'd like to invite them all to come join us to celebrate the progress that we've made in the Bronx and hopefully raise some money to continue to make these strides. So the program will be hosted by Justin Fornell, and we'll be celebrating a number of leaders in the community that have been working towards improving health outcomes. So that includes Michael Brady, the executive director of the 3rd Avenue Business Improvement
You got
District.
the Brady Bunch coming. You know.
We got Michael Rogers, who leads youth and community engagement at the New York Roadrunners Association.
Yes, yes.
We have Iris Rodriguez-Rosa, the Bronx Borough Commissioner at the Department of Parks and Recs.
Yes.
And we're also recognizing a 10-time Grammy-winning musician, composer who supported health causes for his entire career, Brian Palmieri. So. Oh, sorry, Eddie Palmieri.
Eddie Palmieri.
I knew a Brian Palmieri. Yeah, so we have a. I think we're going to have a great night of dancing and music and celebration. So we'd like to
Whoever's
invite.
the DJ has to bring some Palmieri records, of course. Yeah, from Fania, from the Fania record company. They played a lot of his stuff. Well, that's great. So, and this is going to take place October the 11th.
Yep,
and
at
where's it gonna be?
Marina Del Rey.
Marina Del Rey. Oh, yeah. I know exactly where it is. Can I crash the party?
You can.
course.
You're
You
invited.
are invited.
All right. Can the BronxNet cameras come?
They absolutely could.
not?
Yeah, we'd love to. We'd love to
have you.
have it featured on your
All right.
program.
Talk
yeah,
to Helen or
yeah.
Mike Nobby, and they can. If they're not doing anything, I'm sure they would love to come.
That would
down
be
and
wonderful.
We'd
capture
love
it.
to have
Yeah,
you.
it'll be a fun
Yes.
night.
Okay. Where can we go for more information?
So for more information, you can find us on at info@bchnhealth.org. That's by email. Also on our website at www.bchnhealth.com. .org. Or you can call us at 718-405-7795 to get more information about tickets.
I love what you guys are doing. Thank you so much for helping our wonderful people in our community.
Thank you for having us.
Renee Whickey, Community Health Programs Developer, Bronx Community Health Network, and she's wondering if I'm going to say her name right. I am. Zahra Elmekkawy, Board of Directors, President, Bronx Community Health Network.
Thank you for
guys
having
so
us.
much.
Thank you for having
Thanks for
us.
coming, and come back and share more. Okay?
Absolutely.
And we're going to see if we can make this date. I'm going to check my calendar. see
Wonderful.
what I have.
We'll be looking for you.
Thank you.
Yes. Thank you guys so much. We'll take a quick break right here. Stay tuned. We'll be right back. How about those Yankees?